Hello and welcome back to Neo Psychology with me, your teacher, Mr. Neo, the channel where I teach online psychology lessons to my wonderful students. Today, we're carrying on with schizophrenia and we're looking at lesson 10, psychological explanations, and one of the psychological explanations is CBT, cognitive behavioral therapy. Let's get started. There we go. Medication versus talking therapy. Dealing with the symptoms versus dealing with the root cause. Have you ever had to choose between the two before? If you had the choice, would you prefer talking therapy or medication? Of course, there's strengths and weaknesses for each. One's a little bit easier than the other. Which one would you prefer? Which one did you do? If you had a mental health problem or any sort of problem, would you rather have to deal with it with talking therapy or would you rather deal with it with medication? Medication is a lot easier. It's quite easy to take a pill, like bang, I'm sorted. But you know, it's not dealing with the proper problem. Maybe a combination of both will be most effective. Let's crack on, shall we? What are our learning objectives for today? Learning objective 1: show comprehension and apply knowledge of cognitive behavioral therapy, CBT. Some people in the class may have actually experienced CBT. CBT is used for a lot of quite, I don't say popular, but like a lot of frequent mental health problems such as depression and anxiety. And then learning objective 2, to be able to discuss and evaluate CBT. What are the strengths of cognitive behavioral therapy? What are the weaknesses? Let's explore, shall we? Yes, I think we should. Right. We're starting to look at psychological therapies for schizophrenia, right? And we're going to spend 3 lessons on each psychological therapy: CBT, family therapy, and token economy. Today, we are having a look at CBT, cognitive behavioral therapy. The National Institute for Health and Care Excellence recommend that all people with schizophrenia should be offered cognitive behavioral therapy. This form of therapy is referred to as CBTP, or cognitive behavioral therapy for psychosis, when used in the treatment of schizophrenia. So typically CBT is used for people with depression and anxiety and possibly phobias, but with psychosis it's going to be a little different but relatively similar. CBTP in schizophrenia was originally developed to provide treatment for residual symptoms that persist despite the use of antipsychotic medication. It was not to be taken as an alternative to medication, okay? People with schizophrenia must be on some sort of drug therapy, and it's to be used in conjunction. Treatment with antipsychotic drugs still leaves many psychotic patients with persistent positive and negative symptoms, hence the introduction of CBTP to deal with these symptoms and to improve patients' functioning generally. And there's the graph. It's like the way in which you think about it. So with the CBT, if you had CBT, you would know about this. A certain situation might affect any one of those 4 things. It might affect your thoughts, or your bodily sensations, or your behaviors, or your emotions, and each and every one of those things can affect each other. It might be one small situation that might affect your emotion, and that emotion has affected your thoughts, and your thoughts have affected your bodily sensations, and that has resulted in you behaving differently. And essentially CBT is a way of stopping that, and stopping the one all affecting each other, and making a new way of thinking, a new irrational thoughts, and stopping that faulty thoughts. Cognitive behavioral therapy is now commonly used to treat patients with schizophrenia. It usually takes place for between 5 and 20 sessions, either in groups or on an individual basis. The aim of CBT in general involves helping patients identify irrational thoughts or faulty thinking and trying to change them. This may involve argument or a discussion or how likely the patient's beliefs are to be true, and to consider of other less threatening possibilities. This will not get rid of the symptoms of schizophrenia, but it can make patients better able to cope with them. So the drug therapy or the medication is there to reduce the symptoms. The CBT is to help them deal with any symptoms that are left over. If they have an irrational thought and think someone's trying to kill me, it's to challenge those thoughts. Right, think about it. I know I deal with schizophrenia. Is it likely that maybe this is one of my symptoms and maybe someone isn't trying to kill me and it's possibly an irrational thought? Yeah, that does make sense. And it's a way of getting rid of that and challenging those irrational thoughts or those faulty thinking. Now, cognitive behavioral therapy. The cognitive bit is a combination of cognitive therapy, so a way of changing maladaptive or faulty thoughts, and behavioral therapy, a way of changing behaviors in response to these thoughts and behaviors. Therefore, we get the word cognitive behavioral therapy, CBT. Okay, CBT, it's a long definition. What is CBT? CBT stands for Cognitive Behavioral Therapy. CBT was created by Beck, who suggested that psychological conditions were a result of faulty thinking and irrational beliefs. The aim of CBT is to identify the faulty or negative irrational thoughts and then challenge them, reduce them, discuss them. There we go. This often involves argument or discussion, and then the therapist helps the patient to consider realistic alternatives to their faulty beliefs. And there we go. The aim of CBT is to identify the negative or irrational thoughts and then discuss them. This often involves argument or discussion, and then the therapist helps the patient to consider realistic alternatives to their faulty beliefs. I'll give you an example. Okay. I had a patient come to me and he suffered with schizophrenia, obviously, and he came from a black African background, from a very religious family. His mother had schizophrenia when he was growing up, and his father died when he was very young, so there was a very traumatic experience for him, and he came from a very religious black African family background. On top of that, he also had feelings of homosexuality. He was gay, but because he came from a religious background, he sort of suppressed that. And all of those things all together combined, you know, he had the conflict in him with his religion and his feelings of homosexuality. His father dying when he was young, his mother having schizophrenia and growing up in such a crazy household, all developed and all played a role in his development of schizophrenia. He was an incredibly intelligent individual, though. He was an Oxford graduate. He went to Oxford University and got a degree from Oxford University, and he had a master's in law from a different university, if I remember correctly. But I did some CBT therapy with him. I remember he came to me and he said, I went to church the other day. And I was like, brilliant, good. I'm encouraging you to see your religion, because it's okay to be homosexual and to be religious. You know, some people believe that they're inextricably linked, but that's not the case. You can be homosexual and you can still be religious. He goes, I went to church the other day. I said, brilliant, well done. He goes, yeah, something a little odd happened. I was like, yeah, okay, tell me about it. What happened? He said, and this is the best sort of quintessential example of what happened. He goes, there was a statue of Jesus. I said, yeah. And he goes, and for some reason the statue of Jesus had an erection. I was like, okay, right? I was thinking, in a way, it was a beautiful hallucination of all the things that he's had to deal with in his life, with his religion and his homosexuality and his schizophrenia, all developed into one hallucination, one perfect quintessential example of his hallucinations. And he goes, and I felt like someone was playing a prank on me or something. And I said, okay. And I challenged it. I challenged his hallucination. I said, okay, I wasn't there, but I find it unlikely that there was a statue there with an erection of Jesus. Does that make sense? And he says, yeah, that does make sense. It doesn't seem like a normal thing to have happened. I go, there you go. So what do you think this was then? And he goes, it probably was one of my symptoms, one of my hallucinations dealing with schizophrenia. I go, yeah, I would agree. I think it's most likely going to be one of your hallucinations. You see how it fits so perfectly into who you are. It was, yeah, that does make sense. Maybe it was a hallucination. But I go, well, there you go. And it's a way of challenging those things, challenging those hallucinations and those beliefs, or those irrational beliefs. In one example, there we go. The National Institute for Health and Care Excellence recommended that all people with schizophrenia should be offered cognitive behavioral therapy. This form of therapy is referred to as CBTP when used in treatment for schizophrenia. The conventional wisdom has been that psychological therapy such as CBT should be used alongside antipsychotic drugs. Okay, so it's with drugs, it's with medication, not instead of. Patients can be helped to make sense of how their delusions and hallucinations impact on their feelings and behaviors. Just understanding where symptoms come from can be hugely helpful for some patients. If, for example, a patient hears voices and believes the voices are demons, they will naturally be very afraid. Of course, if any of us heard any demons or any voices, you would be afraid. Offering psychological explanations for the existence of hallucinations and delusions can help reduce this anxiety. Delusions can also be challenged so that a patient can come to learn that their beliefs are not based on reality. So, Turkington et al. Described an example of CBT used to challenge where a paranoid patient's delusions come from. So here's an example. The patient: the mafia are observing me to decide how to kill me. Okay, this sounds like a delusion. You are obviously very frightened. There must be a good reason for this, says the therapist. Do you think it's the mafia? It's a possibility, but there could be a better explanation. How do you know it's the mafia? And it's about challenging. How do you know it's the mafia? What makes you think it's the mafia? What makes you think someone's trying to kill you? And in the majority of cases, nobody is obviously trying to kill them. This is a result of their hallucinations and their delusions. Okay. Application question. AO2. Bronwyn. Bronwyn has been an inpatient, so an inpatient is someone that lives in the hospital, in her local psychiatric hospital for the last year. So she's been living in the hospital. She was admitted with a diagnosis of schizophrenia after developing a strong belief that she was being controlled by the government. After a year of medication and a course of CBT, her symptoms are now under control. How might CBT have been used to help Bronwyn with her belief that she was being controlled by the government? Feelings of being controlled by the government. What's that an example of? We learned about in a previous lesson. Not taking responsibility for your own actions and your own thoughts is an example of meta-representation. Okay. How might CBT have been used to help Bronwyn with her belief that she was being controlled? Pause the video, write down your answer, okay? Talk about Bronwyn, talk about specifically her, talk about her symptoms, quote her symptoms in your answer. Give that a go, 5 minutes, off you go. Right, let's crack on with the answer. CBT could be used to help Bronwyn understand that there are other reasons for her frightening experience of external control. CBT would also allow the belief to be challenged. The therapist might, for example, ask her to consider whether the experience might be due to the schizophrenia rather than real attempts to control her. Okay, challenging those things. CBT is all about that, challenging those irrational beliefs. And that's cognitive behavioral therapy, CBT. Identify one thing you learned about CBT. What's one thing you learned? And you might have known quite a lot about CBT. You might have not. What's one thing you learned though? Why do you think learning about CBT is important? Why is this important to know? Understanding therapy is quite important. All of us at some point in our lives will probably suffer from some mental health problem, and CBT could be a way of dealing with that. And I think understanding that and having an understanding of how this applies in our real life is quite helpful. And what questions are you still wondering about? Yeah, has this raised any questions for you? Anything you're still wondering about? Let me know. Here's a quick joke. How many therapists does it take to change a light bulb? Just one, but the light bulb has to want to change. Are you laughing? I'm not. Right. I thought it was funny. I didn't write it. Right, so learning objective 1, show comprehension and apply knowledge of cognitive behavioral therapy. Tick. We're moving on to discussing and evaluating CBT now. What are the strengths and what are the weaknesses of CBT? Okay. Advantages of CBTP over standard care. The NICE review of treatment for schizophrenia found consistent evidence that when compared with standard care, antipsychotic medication alone, CBTP was effective in reducing rehospitalization rates up to 18 months following the end of treatment. CBTP was also shown to be effective in reducing symptom severity, and when compared with patients receiving standard care, there was some evidence for improvements in social functioning. However, most studies of the effectiveness of CBTP have been conducted with patients treated at the same time with antipsychotic medication. It is difficult, therefore, to assess the effectiveness of CBTP independently of antipsychotic medication. So what the researchers found is it's really good and it's really effective to have CBT therapy alongside medication. However, it's difficult to disentangle which one is because of the medication and which one is because of the CBT. But what we know is it's better. CBTP is effective with medication than medication alone. So is this a strength or a weakness? This is definitely an advantage. It's showing how it's quite useful and it's advantageous for the patients that are suffering with schizophrenia. Effectiveness of CBTP is dependent on stage of the disorder. CBTP appears to be more effective when it is made available at specific stages of the disorder and when the delivery of the treatment is adjusted to the stage the individual is currently at. So, for example, Addington and Addington, must be a couple, claim that in the initial acute phase of schizophrenia, self-reflection is not particularly appropriate. Following stabilization of the psychotic symptoms with antipsychotic medication, however, individuals can benefit more from group-based CBTP. This can help normalize their experience by meeting other individuals with similar issues. Research has consistently shown that it is individuals with more experience of the schizophrenia and a greater realization of the problems that benefit more from individual CBTP. So what this is saying is, the effectiveness of CBTP is dependent on what stage of the schizophrenia you're at. If you're right at the beginning and you have lots of hallucinations, lots of delusions, or lots of other symptoms, it may not be appropriate or may not be effective way or may not be an effective treatment. But once they've sort of stabilized your behavior, got you on the routine of medication, and maybe succumbing some of the symptoms or reducing them, maybe that's when CBTP is most effective. So, is this a strength or a weakness? It's a weakness or a strength. It's a bit of both. I would say it's more of a weakness because it's saying that it's not appropriate in all cases. Lack of ability of CBTP. Despite being recommended by NICE as a treatment for people with schizophrenia, it is estimated that in the UK, only 1 in 10 of those who could benefit get access to this form of therapy. This figure is even lower in some areas of the country. A survey carried out by Haddock et al. In the northwest of England found that of 187 randomly selected patients diagnosed with schizophrenia, only 13, which is just short of 7%, had been offered CBTP. Offered, not even taken up, just offered. Of those who are offered CBTP as a treatment for schizophrenia, a significant number either refused or failed to attend the therapy sessions. Freeman et al. 2013, thus limiting its effectiveness even more. So it's saying So few people are even being offered the CBT, right? It's one of the problems, especially in the UK, where people with mental health problems are not getting the help that they need. The NHS is lacking funding and needs more funding. Boris, are you listening? And I'm not going to make it political. And the people aren't getting the help they need. They're not getting the therapy they need. And as that's evident from this piece of research by Haddock et al. In 2013, just short of 7% of people with schizophrenia were offered CBT therapy. And of those 7%, the majority of them didn't even take it up. So is this a strength or a weakness? This is a weakness. The lack of availability of CBTP is an issue. Right. Outline one strength and one weakness of CBT as a psychological therapy for schizophrenia. Okay. Be sure to answer the question in Peel paragraph structures. Points, give your point. Evidence, back up a piece of research. Explain it. Explain your point. Explain it further. Keep going further and further. Keep explaining it. Why is this relevant? And then link it back to the question. There we go. Right. And that's the evaluation of CBT, right? You're just evaluating what are the strengths and what are the weaknesses. Identify one thing you learned from the evaluation of CBT. Why do you think learning about the evaluation is important? It's important to know about the strengths and weaknesses of CBT. Okay, people might go, oh, CBT is brilliant, it's really good for you. Yeah, okay, great. What are the strengths? What are the weaknesses, though? I need to know both sides of the argument. Okay, is it good to take it with medication? Is it good to take it without medication? Can I take CBT without medication? No, you need to. Well, depending on what it is. Something like depression might not be necessary to take medication, and you might be dealt with through CBT. It might need medication though, but something as a severe mental disorder like schizophrenia is essential to take medication, and it's found that it's most effective to be accompanied with CBTP, cognitive behavioral therapy. But as we saw from the research by Haddock, people aren't even being offered it the majority of the time. How does the evaluation apply in real life? If you have to deal with anyone, not just people with schizophrenia, but people with depression, people with anxiety, we need to have a more open communication about therapy, because it's got a bit of a social faux pas. It does feel a bit personal if you're going through therapy and going like, you might not want to share that with someone else. Oh, I'm going through therapy at the moment. It's quite a personal thing, and some people don't want to share it, but that's up to you. But it's nothing to be ashamed of, though. You know, do you get physically ill? Yes, everyone gets ill. Everyone goes to the doctor, right? This is an absolute fact. Everyone gets ill. Everyone goes to the doctor. Just as well, in the exact same way, people are mentally ill. You get mental illnesses all the time. In the same way, you need to go and get therapy. You need to go and get potentially medication as well. This is perfectly normal. And what questions has evaluation of CBT raised for you? What are you still wondering about? Have you got any questions? Any interesting questions? Some of you come up with really interesting questions. Let me know. It's good to discuss these things. There you go. Learning objective 2 sorted. Can I tick it off? Good. Learning objective 2 to be able to discuss and evaluate CBT. On to the plenary. Wow. Okay. Here we go. Look at the following case study and answer the question that follows. Maria first demonstrated her symptoms during an early session with her psychiatrist. She would complain of pains in her stomach, which would cause her to start to become increasingly more stressed. This increase in stress was evident through visual signs like sweating and shortness of breath, as well as being accompanied by an increase in the amount of pain Maria reported. Maria said that the pain was being caused by a special communication device that had been implanted in her body by her ex-husband before she divorced him. When questioned further about this, Maria said he had set up the device so that it only caused her pain when he activated it in order to talk to her. This is why she started to hear his voice in her head after the pain had started, often telling her what an awful wife she had been, and that if she did not agree with this, then the sensor would kill her by exiting her body through her stomach. Okay, so she's got hallucinations and delusions. Maria, so she's got the auditory hallucinations of the voices of her husband, and the delusions that there is something in her stomach that's causing her pain that was implanted by her husband. Maria would then start rocking back and forth, holding her stomach, saying out loud what a horrible wife she had been, and begging her ex-husband not to punish her further by killing her with the device. Eventually, she would calm down to the point where she would excuse herself to use the toilet. Once she came back in, she always felt a lot better after the voice and the pain had gone away. The psychiatrist reviewed her medical records to find out whether there was any genuine physical basis for any of her symptoms. As it turned out, her psychotic symptoms started to occur at about the time she had been diagnosed with irritable bowel syndrome, about 7 years previously. This is an illness that causes the person to experience stomach pains and diarrhea. This also occurs just after she had experienced a messy divorce from an intense relationship with an abusive husband. Okay, there we go. That's Maria for you. Number 1. Identify the 2 main symptoms of schizophrenia demonstrated here. Okay. Number 2. What were the triggers to this particular psychotic episode? Number 3. Suggest a way you could reality test the irrational beliefs concerning the monitoring device implanted inside Maria, so using CBT. 4. Suggest other cognitive and behavioral strategies that could be used to treat Maria. And then extension, what do you think caused her schizophrenia in the first place? Right, take some time, read through the thing again, and then answer those 5 questions, please. Give that a go. Pause the video and give that a go. I'll know from your answers if you didn't it yourself or you just copied, and let's go through the answers now. Okay. Identify the 2 main symptoms of schizophrenia demonstrated here. 1 relates to irrational beliefs based on no real evidence, which is the delusions, and other relates to hearing voices that are not there, which is auditory hallucinations. Auditory because she can hear the voices. What were the triggers to this particular psychotic episode? Focus on the physical changes in her that occur before she starts to hear the voice. Oh, these are hints. 3. Suggest a way you could reality test the irrational beliefs concerning the monitoring device implanted inside of Maria. Given that the pain is being caused by her having IBS or irritable bowel syndrome, how could it be demonstrated to her that she had this illness? And then 4, suggest other cognitive and behavioral strategies that could be used. With cognitive strategies, think of a specific task that would focus her mind sufficiently to distract her from her delusional thinking. For example, what did participants do to prevent rehearsal of the trigrams of the study of duration of short-term memory? Think of positive self-talk that she could say to herself in response to negative things she is thinking or negative voices she is hearing. With behavioral strategies, what could be done to drown out the negative voices she is hearing? Possibly like listening to music is one way of doing it. And there we go. Thank you for joining today's lesson. Today was lesson 10, Psychological Therapies, CBT. Be sure to submit your notes on the lesson. Next lesson is lesson 11, Psychological Therapies, Family Therapy. Be sure to write up your notes for this lesson. Well done, my neo-psychologist. Great job today. God bless. I've been Mr. Neo. Peace.
I'm feeling like Will. I feel like a prince. I'm feeling myself. I'm loaded with bills, cause I wasn't blessed with no Uncle Phil. Don't know how it feels. I wanted to flex, they told me to chill. I'm making a flip. My life is a flick, now load up the film.